exorcisms. Is that right?
I'll accept that, Senator, but that's.
They pay, the California Medicaid program will pay for herbal medicines, meal deliveries. They'll pay for housing. I don't know what housing has to do with health care. Is that correct?
For every dollar California puts into its Medicaid program, federal taxpayers put up 9 to 1. And some of what that money is being spent on is going to stop you in your tracks. Welcome to American Hearings. Senator Kennedy just walked a top federal health official through a list of Medicaid-covered services in California that nobody in Washington seems to want to talk about. Exorcisms, in-home chefs, student loan repayment, gym memberships. Let's get into it.
Senator Kennedy.
Thank you, Mr. Chairman. General, how are you?
I'm great. Thank you, Senator.
In America, unlike other countries, where they let you die in a ditch, in America, if you're too poor to be sick, we'll pay for your doctor. Isn't that right?
It is.
And one of the programs we do that through is Medicaid.
Correct.
Okay. And this money for Medicaid, it didn't just fall from heaven. We thank heaven for it, but it came out of people's pockets, didn't it?
Every dime of it.
And some of that money is stolen, isn't it?
Yes.
And the states, not all of them, but many of them, allow it to be stolen, don't they?
Yes.
Let's take Medicaid in California, for example. I don't mean to just pick on California, but because this happens in other states. We saw it happen in Minnesota, for example. But in California, for every dollar that the California state government puts up for Medicaid, for the Obamacare portion of Medicaid, the federal taxpayer puts up $9, don't they? And so, is that right?
That's correct, Senator.
And so, as a result, California has allowed thousands and thousands of these social assistance and so-called health care providers pop up in California, haven't they?
Yes.
And some of those providers steal the money, don't they?
Yes, we know that to be true. Yes.
And the money never gets to the people they supposedly are trying to help. Isn't that correct?
That's correct.
And the other way that California and others abuse the fact that they're putting up $1 and the American taxpayers putting up $9. Did I mention it was $9?
I think some say it's even more, but yeah. 9 work.
They expand the services, don't they?
Yes.
Because some states, like California, I don't want to paint with too broad a brush. It's not everybody in California state government, but it's a lot of them. They see this as free money, don't they?
They're not paying for it, yes.
Isn't it a fact that, for example, Medicaid in California will pay a provider to provide tribal prayers? I looked all this up.
I mean, I'll accept that. I didn't know that, but yes.
That California will actually pay a health care provider, I didn't know this was a medical expertise, to pay for exorcisms. Is that right?
I'll accept that, Senator, but that's.
The California Medicaid program will pay for herbal medicines, meal deliveries. They'll pay for housing. I don't know what housing has to do with health care. Is that correct?
Yes.
Were you aware that the Medicaid program using federal money, taxpayer money, will pay for an in-home chef?
Yes.
Okay.
Even if it's a family member, yes.
Yeah, they'll even pay for gymnasium fees through Medicaid in California. They'll pay for bicycles, scooters, gym memberships. Did you know that?
Yes, several states do, but California does for sure.
They'll even repay your student loans. Were you aware of that?
I was not aware of the student loans repayment.
Yeah, they'll repay somebody's student loans to encourage them to become a health care provider. I mean, California, they're just setting all kind of records. These folks are they're wild people. California's got 12% of the population. In the last 10 years, they're responsible for half of these new so-called health providers to provide exorcisms and other things. Now, what the hell are we doing about it? Why has this gone on for so long?
Senator, listen, it's a great question. And what you just described are programs that are allowed under the program. You have a whole other issue in California where a lot of these folks are just stealing the money, not even running it through for exorcism.
They're thieves, aren't they?
They're thieves, correct.
And California just watches it happen, don't they? Not everybody in California. The government does, doesn't it?
Well, that's the challenge in a lot of states, is that we don't have a state government, which you all have entrusted to run these programs and take care of the money that you all give them. There's state structures that absolutely do not do any compliance, and they don't do their job.
Because they don't have no incentive to. They're getting free money. Isn't that right?
Yes, I think so, yes.
We got to change this, General.
We're trying.
I call this a slush fund. You want to talk about slush fund? This is a tier 1 slush fund that's been going on for years and years and years. Billions, hundreds of billions of dollars is stolen.
Yes, Senator. And that's why, look, this department stood up a whole new fraud division, and AUSAs around the country prosecute fraud every day. So it's not as if we didn't have the work out there, but it's so systematically taking money from the American taxpayer that we very much believe that it needs its own stand-up structure, and I think it's true for the reasons that you just said.
If you need an exorcism, you can go to California, can't you?
Thank you, Senator.
Welcome back to American Hearings. Senator Kennedy opens this exchange with a premise most people accept without thinking twice. In America, if you're too poor to be sick, the government pays for your doctor. That's Medicaid. And by almost any measure, that's a program worth defending. But Kennedy isn't here to defend the concept. He's here to talk about the execution. The 9-to-1 funding ratio is the foundation of everything that follows. For every dollar California puts up, federal taxpayers contribute 9. And when you're spending $9 of someone else's money for every one of your own, the incentive to be careful with it changes dramatically. This is the structural argument Kennedy is building. Not that Medicaid is bad, but that the funding model creates conditions where oversight becomes optional and expansion becomes almost irresistible. Then comes the list. Tribal prayers, exorcisms, herbal medicines, meal deliveries, in-home chefs, gym memberships, scooters, bicycles, student loan repayment. The official doesn't push back on a single item. He accepts each one as accurate. That confirmation, delivered calmly under oath, lands harder than any reaction Kennedy could have shown. California represents 12% of the national population and was responsible for half of all new so-called healthcare providers registered in the last decade. Kennedy plants that statistic deliberately. It doesn't need commentary. It speaks entirely for itself. The underlying point here isn't partisan, it's mathematical. When states treat federal matching funds as essentially free money, the definition of what qualifies as healthcare tends to expand in creative directions. And the people the program was designed to help are often the last ones to benefit. If you want to understand how federal program dollars drift from their original purpose, this exchange is a textbook example. Subscribe to American Hearings and share this one. Drop a comment on what surprised you most.